Hello, my name is Dr. Terry Oler. I'm a podiatrist at Totally Feet Podiatry and Laser Center in Westminster, Colorado. Today I'm here from myfootsupply.com and we're going to be doing our Orthotics 101 tutorial. We're going to be covering the anatomy of orthotics, what they're used for, and tips on how to use your orthotics most effectively. So let's talk about the anatomy of an orthotic. This is a prefabricated orthotic. This orthotic has an arch, a heel area where in some orthotics there's actually a heel cup, and a forefoot area. This particular prefabricated orthotic comes with a small metatarsal pad-like area. This is a little elevation that you may be able to see on the front of the orthotic. There's a common misconception amongst orthotics. Oftentimes people will ask, where's the rest of my orthotic? In a lot of custom functional orthotics, a top cover may be included with your orthotic. This is a soft foam or neoprene material that usually covers the surface of the orthotic. This is used to help cushion the orthotic and make it feel more comfortable. In my personal preference, I like to give our patients the plastic shell only. The reason I like to do that is because I like my patients to remove the insole of the shoe and put the orthotic into the shoe correctly. Let's go over how we do that. My old basketball shoes. So the insole comes up. I hope you can see that there. Then we stick the insole or the orthotic underneath the shoe's insole. Then we set the insole that came with the shoe back down. What this does is it cushions the orthotic with the insole that's fit to your particular shoe. When I have patients that are using top covers that come with their custom functional orthotics, oftentimes they cut the insole, or the top cover I should say, to a particular style of shoe. Well, when they go to move that orthotic and the top cover to another shoe, that particular style of shoe has a different structure. Then they have to retrim that material again. Also, with top covers, they do wear out over time, as do insoles in shoes. Fortunately, the insoles of shoes often wear out about the same time the shoe wears out. So when you're buying a new shoe, you get the same, you get a new insole, so you can use the new insole with each shoe. And the insole fits perfectly with every shoe that you use it with. What are orthotics used for? Well, orthotics are used to prevent excessive pronation during certain phases of the gait cycle. Excessive pronation can cause plantar fasciitis, arthritic changes in the midfoot, arthritic changes in the big toe joints, tendon issues, dysfunction. It can also lead to tendon ruptures and several other problems that are associated with pain in the foot. Also, excessive pronation can cause knee pain, hip pain, and back pain. All of these structures are very closely related to the way we walk and excessive pronation. So how do we use our orthotics? I talked a little bit about this in the anatomy of an orthotic, but let's go over it again because it is very important. So first, when you're out selecting shoes, make sure that you find a shoe that has minimal compression when you push on it on the toe and the heel. You do not want a shoe that is easily collapsible. Secondly, make sure that your shoe has a good heel counter. This helps to keep your heel in a good alignment when you're wearing your orthotics. Lastly, when it comes to the shoes, make sure that your shoe does not have a lot of twist in the arch. This doesn't allow the orthotic to function correctly. A good shoe that has a vast that comes through the midfoot is ideal, but not necessary with some orthotics. When you're putting your orthotic in your shoe, make sure you lift the insole of the shoe up. That's why we need removable insoles. Slide your orthotic underneath the insole of your shoe. Then push the insole back down. Now, I always tell my patients to make sure that they wobble the orthotic back and forth. This ensures that the orthotic is well seated on the midsole of the shoe. So, when you have your orthotics in your shoe properly, what else do you need to know? Well, it's important that you break your orthotics in as needed. Now, this can be different for each individual person. Some people that have worn orthotics in the past may be able to go ahead and start wearing your orthotics right away out of the gate. Other individuals may need to go through what's called a break-in period. The break-in period is the period in which your feet are allowed to acclimate to the new arch supports in your shoes. I tell my patients 1 hour the first day, 2 hours the second day. By the end of the week, they're up to almost 8 hours, a full day.